leg amputations can reduce the quality of life, but also shorten the patient's life. This is considered a limb salvage procedure. The current condition of her limb prior to surgery was going downhill, where she was going to break down and get a potential sore on the bottom of the foot, an instability which would potentially lead to an infection and losing a leg. We relate this to a Charcot event, and she was getting a lateral deviation of the foot and a collapse of her arch, so she was walking more on the arch of her foot or rocker bottom foot. It was an unstable gait for her. She recognized that the deformity was getting worse, causing more instability, more deviation. So this is a device that we put on after we do a midfoot arthrodesis. We resected the non-union bone, aligned the foot in a more anatomically and biomechanically correct position, and then held it in position with temporary fixation, sewed up all our incisions, and then we applied this frame percutaneous with wires through the leg, ankle, and foot in a fashion to stabilize these rings to her leg and then stabilize the fusion side so there's absolutely no motion. And then we start load bearing her immediately after surgery to help dynamize the bone. And typically a patient with a neuropathy or a Charcot deformity can expect to be in a frame for about 3 to 4 months. We also utilize these frames for acute trauma, ankle fractures, arthritic conditions of the foot. So there's a lot of uses for them, and it increases what I think would be salvaging a limb that was going to a route that would be non-salvageable. You know, there are other doctors out there that see these feet, and this is pretty involved emotionally for the patients. You know, from a mechanical standpoint in the operating room, there are a lot of doctors that still will go to a leg amputation and they won't attempt a reconstruction.